Mhm. Hi guys, good afternoon, or more like good evening. Welcome to another AMA session with Dr. Ben. I'm Dr. Ben Behnam. I'm one of the founders of Happy Head and the Chief Medical Officer. Um, and today we are actually having our AMA in the evening as opposed to our usual Tuesday mornings. So welcome. Our first, usually start with the topic, and today's topic is what to expect after using Happy Head for 1 month. This is a very common question that we typically get. And the answer is that most of the time, really nothing. You have to realize that the hair cycle takes several months. And all these, unfortunately, all the other companies that claim that after a month you're going to see full hair growth, it's really not true. We use prescription grade products, and it typically takes about 4 to 6 months for patients to see results. Now, there are some patients that after 1 month they're going to see improvement, and that's great. I love it, but that's not the typical results that most people get. So the key is to really set the right expectations. And we typically say about 4 to 6 months, that's when you're going to see basically your best results. So, and actually today I saw one of my patients back after 4 years of using Happy Head, and one of these days I'm going to share the photos with you guys. He looks amazing, way better than he started back in 2018. So the results of Happy, given the fact that there are multiple different ingredients in one, the results stays consistent. Whereas, for example, if you were to take like Orpapisha, a lot of patients plateau on it just because it's just one product. Here we go. So we're gonna start answering the questions. Um, Okay, somebody already said, what should I expect after the first 1 month? We already talked about that. Now, if you are experiencing any side effects within that 1 month, we'd love to hear about it. Some of the most common side effects basically would include flakiness and irritation. So if that happens, please let us know. So what are the best ways to reduce the flakiness and irritation? Number one, you could start washing the product off after 1 hour, and that usually helps a lot. You could start using the product once a day as opposed to twice a day. You can also use a leave-in conditioner, and what that means is basically it's a conditioner that you use at the end of the shower, and you just leave it in, and that's very moisturizing. If none of those help, you can also reach out to us. There's a special serum that we have. There's a scalp moisturizing serum that we'll be more than happy to send you. That's very moisturizing. And also, we could change out some of the ingredients. So we might lower the concentration of minoxidil from 8 to 6%, or sometimes even take it out completely, or reduce the concentration of retinoic acid, or take that out. We also have a water-based formula, and I think this is probably one of the easiest solution, is that if you get some irritation, let us know. We'll switch out your product, no additional charge. We'll ship you out a product that's called water-based, and what it is that it has less alcohol in it, and as a result, it is not as irritating. So there's a lot of things that you could do. We are here to help you get in contact with us, and we'll guide you on how to do it. We also have videos on basically where I explain this entire procedure, and it's somewhere on our website. So I want to get your suggestion regarding application of the dropper. My question is it recommended just to apply the drops directly onto the scalp, or should it be massaged into the scalp after applying as well? Um, so the correct way of doing it is take the dropper, have the pipette kind of semi-touch your scalp, and basically release basically the tip, so you basically get the fluid onto your scalp, and then you're gonna massage it onto your scalp. So I'm gonna repeat this again. So take the dropper. I wish I had a dropper here. Here we go. Here, thank you, Eric. So here we go, guys. So this is the dropper. So literally touch the scalp with it, and basically, and then you're gonna do release, and then massage it in, and then do another pump, apply this, touch the scalp, and basically push it down and release the fluid. Um, the reason why we use a dropper and not a spray is because if you were to use a spray, a lot of the fluid's gonna get stuck on basically on the hair, so you're not really getting on the scalp. The dropper really allows an easy application directly onto the scalp, and you're going to massage it in. The wrong way of doing it is to be like about 5 inches above the hairline and basically dropping it. it's not gonna. I mean, that's gonna get on your face. It's not gonna be good. Uh, some people like to put in a spray bottle. Again, we've done a lot of experiments at the beginning when Happy started with a spray bottle. We do not recommend it. It gets stuck on your hair. You're really not getting it directly into the scalp where you need it. Also, sometimes patients would apply it on their hand and then rub it on. Again, it's too messy. It's too messy. I would just drop it directly onto the scalp. That's a very good question, by the way. Thank you so much. Um, we should probably post that up somewhere. I think that was a very good question. Can you explain why patients may experience an initial shedding? Sorry, guys, there's an ambulance going by. Initial shedding. So the initial shedding comes mainly from the minoxidil. So even if you use some of the minoxidil over the counter, it writes on it that an initial shedding could happen. The reason is because it's trying to reset your hair cycle. So that's why basically you're gonna lose basically that hair. But it's always a good thing because if you go through the initial shedding phase, those patients typically end up with much better results. Um, the shedding typically happens about 5% of patients, and it could last about 6 to 8 weeks. Now, let's say if you're using the product and you're shedding even into the third or fourth month, well, you should definitely let us know. Usually, what we do is we ask you to send us updated photos, and we compare your photos to the initial photos. And I'll tell you, in over 95% of the cases, patients have more hair at that fourth month than they did initially, despite the fact that they're saying that they're having more shedding. So, but again, if that happens, let us know. So, I've been using Happy for 1.5 months. After microneedling, I apply Happy, but it stings a bit. Not an issue for me because it goes away. Is that okay? How often should I microneedle and how deep? So there are a couple different ways of microneedling. You could microneedle first and then apply the Happy on top, or you could apply Happy on top and microneedle. Both ways are good. Um, it's obviously going to sting a little bit just because the product is alcohol based, so you're getting some of the alcohol into your scalp, so stinging. It's perfectly normal and that's fine. You should microneedle every night. I would recommend using the 0.25 depth and doing it every night. So apply the Happy on top, then gently microneedle and do it every night. Use a 0.25 depth, um, and just be consistent about it. The microneedling really does help a lot. Now, I know a lot of patients get on the internet and they start reading how other people microneedle. And the way that other people do it is that they use a 1.5 millimeter depth and just do it once a week. I just feel that is way too strong. And look, I just finished doing 2 stem cell PRPs in my office, and I use a 1 millimeter depth when the patient is numb and they still feel the pain on laughing gas. So I'm not a big fan of using the 1.5 millimeters. I think patients could get very good result if you use the 0.25 millimeter consistently every night. It's not gonna hurt. You shouldn't bleed. Don't press too hard on it. How often should I replace the derma roller? Is there another device one can use other than a derma roller that produces similar or better results? So you should probably replace it once a month, and basically after every application, just spray some alcohol on it to disinfect it. There is also what's called a derma pen. These are automatic devices basically that put the needles into your scalp. So there's a couple brands out there. You could definitely Google them. I like the derma pens. I think Happy is also we're also coming out with our own derma pen as well. It's just an automatic one, and that could probably give you similar or sometimes better results, but pretty much similar actually. Also using Theraderm 4 times a week, is that okay, or is it working against happier therapy? So just to let everyone know what Theraderm is basically one of those laser light therapies. Uh, Look, my recommendation is that it's about 50-50. I think it works about 50% of patients, and the other 50% just doesn't work, but it's not going to hurt you. So if you want to use it 4 times a week, please do. There's nothing wrong with that. I buzzed my head a few weeks ago, and I buzz it every few days now. Can I use Happy Head while I continue to buzz cut every few days? Yes, absolutely. In fact, uh, patients that have like a short hair, like a buzz hair, they do so much better on Happy Head. And the reason is because it's just much easier to get it onto the scalp. So yeah, it's fine. Buzzing is good. Definitely derma roll afterwards. You're gonna see good results. There's an Australian study that basically showed patients that had buzzed hair and they did derma roller, and but just derma rolling, they got very good results. So if you combine the buzz head with the happy head and derma roller, you should do well. Is there any value in using scalp stimulating brushes? If so, is there a brush you can recommend? So here's my opinion. I know there's a lot of brushes out there and massagers out there, but honestly, I think the derma roller is a much better device because it has 540 spikes. It's literally creating channels in your scalp that's stimulating collagen production, increasing blood flow to your hair. So I think the derma roller is what I would use as the brush. I was wondering if the doctor-based formula is just an absorbent and if it does on our scalp just as well as a regular alcohol-based formula. Yes, it does as well. So with the water-based, there's still some alcohol in it. The reason is because for the minoxidil, for that to dissolve, it has to be dissolved in the alcohol-based formula. You can't take minoxidil and put it in the water; it's just not going to dissolve. So for the minoxidil to be affected, it has to be dissolved in the solution, and which means they have to have some alcohol in it. The only difference is that there's just less alcohol in the water-based formula, and is as effective. We've been using actually the water-based formula for a while now, so it is as effective. And does uh, and does the wind affect absorption? I mean, I don't understand that question. I don't know what that means. Please repeat it. Um, Is it okay for you to use the ketoconazole 2% with Happy? Yes, it's okay. In clinical studies that actually Eric pulled up yesterday, the ketoconazole 2% has been shown to increase the caliber of the hair follicles. So it is okay. And we do have the ketoconazole 2% shampoo. It's just not on our website yet, but you could definitely email us and we'll be more than happy to prescribe it for you. When can I use to get the most out of the product, and does red light therapy help? It typically takes about 4 to 6 months for you to get the most out of the product. Again, it's not going to be in 1 month. Most patients do not see results in a month or two. It really takes about 1 to 2 hair cycles for the hair to go through for you to see the best result. You could use the red light therapy in conjunction with it. Again, it's about 50-50 in my personal opinion, but it's not going to hurt you. If I use more than 1 ml per application, would I see faster results? That's a very good question. Most probably you might. It's just the fact that you might also increase your risk of side effects as well. So the 1 ml is based on the clinical studies that were done. But let's say if someone wants to use the product just once a day as opposed to twice a day, so I usually tell them to use 1.5 ml in one application. But if you're using it twice a day, my recommendation is 1 ml to reduce side effects. Remember, guys, it is not a race. The people that do the best are the ones that do it slowly and do it consistently. So it's like I have patients, when in the old days, when we used to prescribe oral propecia, they would start doubling, tripling on the pills, taking 3 tablets a day. Well, they just ended up basically having more side effects, and then they had to stop the whole treatment. Whereas the people that started slow and then more consistent, it took longer period of time, but they were the ones that had much better results in 6 to 9 months. And these are the people that basically literally took it for 10, 15 years. So remember, it's not a race. Patience is the key. Should I shower before the second application? You don't necessarily have to shower before the second application. No. Should I avoid specific shampoos? I mean, not necessarily. Uh, there's no specific shampoos for you to avoid. Happy it does have really good shampoo we came out with. That we're actually sending the sachet to everyone, so you guys could try it out. I actually use the Happiness shampoo at home because it's full of collagen, keratin, saw palmetto. Basically, we took the best of every ingredient out there and we put it into our shampoo. But there really isn't any restrictions on any other shampoo. Um, oh, here we go. Thank you, Eric. So guys, here's our thickening shampoos and our thickening conditioner. My wife used up all the thickening conditioner, by the way. So I need to get another one.
These are going in every order starting.
So yeah, so basically, starting this month, basically every order is getting a sample of our sachet of one of our Happy shampoos and conditioners. The way I use it is basically I use a little of the shampoo and basically rub it into my scalp and rub it in, and then I put the conditioner on. The conditioner is really really good, um, and they both have kind of like this citrusy flavor to it. So you guys will like it. If there's any questions, let us know. Um, okay, I meant like if the wind dries it too fast or not. Oh, oh, yeah. So oh, I see what you're saying. Okay. So the product first of all is alcohol based, so it should really dry up right away. Number two, typically, if you look at some of the pharmacokinetic studies, majority of the product actually gets absorbed into the scalp within the first 2 hours. So that's why it's okay if it's drying you out and you're having some flakiness from it. After 2 hours, just wash it out. You're perfectly fine to do that. Um, any info about the new drug? Oh yeah, the new drug that was approved by the FDA. So the drug that was approved by the FDA is for alopecia areata, not male or female pattern hair loss. So alopecia areata, also commonly referred to as alopecia, is an autoimmune condition where the body attacks the hair follicles, and then you get these round patches of hair loss all over the scalp. So I have alopecia areata. So my first one was about 10 years ago, and I got a patch this big of hair loss. The problem is that a lot of the standard drugs like Happy typically does not work for alopecia areata. The only thing that will work for it is injection of Kenalog. And sometimes patients who have what's called alopecia totalis, where the entire scalp basically they're going to lose the hair. So the new drug is FDA approved for alopecia areata, not male or female pattern hair loss, and it's just not going to help you, and it also has other side effects. So it is not for us. Can one use ketoconazole shampoo too much or leave it on too long? Well, it's irritating, so you don't want to leave it on too long. My recommendation: just leave on the shampoo for about 3 to 5 minutes, and definitely wash it off and use a conditioner afterwards. Definitely, you got to if you're gonna use a ketoconazole shampoo, you need to use a conditioner because it's drying and a little irritating. How long should you wait before adding hairstyling products? Just let it dry for a few minutes and then you could do whatever you want. That's not a problem at all. Like 3 to 5 minutes at the most. The color of my happy it changes sometimes. Sometimes clear, sometimes yellowish. Does that matter? No, that doesn't matter. So a lot of coloring has to do with the fact that remember these are all customized products, but the shipping. So basically, as it gets shipped to you, it really depends where you are in the country, and depends on the weather conditions. So if it's too cold or too hot, basically that's gonna start affecting some of the color, but the concentration and the ingredients does not change at all. So that should not be a worry. Oh, so here we go. So here's a question, my third question of the day about this one. Are we able to get finasteride increased to 0.3 from the 0.25? Since I saw one other product from one of our competitors make that concentration. So the reason I'm going to explain this. So the reason why is 0.25 is because um, a lot of the clinical studies had the 0.25 when we started out 4 years ago. And also one of the reasons why we didn't want to go too much is because of the potential risk of just more additional sexual side effects. Currently, we are having a meeting and we will figure out to see if we're going to allow customization up to 0.3.
I also think they are rounding it.
And also, thank you. So Eric, our VP of operation, we really think that they're just rounding it to 0.3 and it's not really 0.3. Um, but we are, in one of the original studies actually was 0.5, and way back in early days of Happy, we did try 0.5 and patients had more side effects. So we don't want to up the dosage too much. And also another thing is that if you look at the pharmacokinetic studies of finasteride, and these are all listed on our website. If you go to the blog, there is an article that I wrote over 2 years ago about the side effects of finasteride, and it compares the pharmacokinetic studies. The reason why we chose 0.25 is because the 0.25 concentration done twice a day gives people the same pharmacokinetic effects as the 1 milligram pill taken once a day. That's what it's done. So when you're gonna do 0.3, you're actually taking technically more than 1 milligram of oral propecia a day, and that could lead to more side effects. But Chris, do you mind just emailing us about the potential of increasing to 0.3? Again, we are having an internal discussion, and we'll get back to you if we're going to allow that or not. Thank you so much for that question, though. Oh, would it make much difference from 2.3? I really don't. I think you're just increasing your side effects more, and honestly, I don't think you're gonna make much of a difference. That's my personal opinion. How often should we send progress photos to you for evaluation? Again, usually, look, again, the results you're gonna see 4 to 6 months. So I would probably, do it about 4 to 6 months.
Monthly.
But Eric says you should take the photos monthly and you should watch the progress. But they're asking if they want to send it to us. Send it to me like every 4 to 6.
You can send it every month.
Oh, Eric said you could send your photo to him every month, and he'll be more than happy to evaluate it. I'm up for that. I have nothing. Look, I evaluate photos all the time, and if you guys have any questions, if you guys are a good candidate or not, please send them over to me, and I do evaluate them all the time. So you're more than welcome to send the photos in. We put it together with previous photos and really compare it. But I mean, a month or two into it is not going to help you at all. You really got to wait that 4 to 5 months. So I have been having trouble receiving my order. It's now been 2 weeks, and I tracked my order, which is now lost in Iowa, and I'm in New York. This is not the first time. Oh, that one went away. The question went away. So okay, so if you're having trouble, that was so. So first of all, I apologize about that. I mean, we really work very hard. To make sure that nothing gets lost, but unfortunately, we have no control over USPS. I guess if you want to ship it with FedEx, there might be some options that you might be able to upgrade your shipping. Can you please email us that? Please send us an email to help at Happy Head, and we're gonna basically figure out why you're not gonna receiving your order. We'll replace it right away for you, and we'll figure out if you want to upgrade it, we'll figure out a way to upgrade that. We'll connect you with Eric, our VP of operations, and we'll figure it out. Thank you so much for that question. Is there any rationale why finasteride topically might be better than dutasteride topically? Great question. Well, we know in clinical studies, oral dutasteride they're better than oral finasteride. That we know for sure. There actually has never been a head-to-head dutasteride versus finasteride topical clinical study, but assuming from the clinical studies, dutasteride should work better than finasteride. It's just the fact that the topical finasteride is the one that has the longest track record with Happy Head, and that's what we started out with many, many years ago. So that's our most popular product. But you could definitely start with dutasteride, and there's nothing wrong with it. How much hair loss is normal per day? You could lose up to 100 hairs a day, and that's normal. 100 hairs a day. So I have patients that come in and literally they're losing 10 hairs a day. Yeah, that's definitely normal. Absolutely.
Is it also normal to see more hair loss after you start getting your hair back?
Yes. So yes, here's the thing. So and also another thing is the more hair you have, the more hair you're gonna lose. So I have patients that come in after a year of using Happy Head, they're like, Doc, I'm losing more hair now than I ever did. I'm like, yes, because you have more hair to lose. So, and always take photos and track the progress, and in those cases, those patients really have more hair. Next week, I will show you my patient photo who has been on Happy Head for 4 years. I saw one of my patient back today, 4 years on Happy Head, and he looks amazing. And I'm gonna show his before and after photo. So just an encouragement for everyone out there. No, don't apologize for asking so many. One of my patients said sorry to ask so many questions. We love these questions. I love it. All right, guys, today we have a hard stop at 6 o'clock, so I'm going to try to get through all the questions. For patients with allergies to over-the-counter minoxidil, would it be preferable to do a hair transplant instead? If so, can a hair transplant be done with occasional outbreaks of folliculitis or alopecia areata? So this is a very loaded question. So first, if you're allergic to minoxidil, you could get the product without minoxidil in it. It's just going to be finasteride or finasteride with retinoic acid. Number two, if you do choose to get a hair transplant, uh, yes, hair transplant, you could have outbreaks of folliculitis because as you have more hair coming out, you could get more ingrown hair follicles basically on your scalp. So that could happen. Um, and then also, now with respect to alopecia areata could happen after hair transplants. We do see it. It's not very common. It's a shock loss, but yes, it could happen. I mean, we do hair transplant in the office every day, so we do see it all the time. For patients, okay, we're done that. Okay, once results are seen, do patients typically stay on your medication or do they use it at a lower frequency? So, great question. Um, both. I mean, there's no really wrong or right way. Typically, for patients to see the results, they continue to use it twice a day every day. Some patients go back to doing it once a day every day after 6 or 9 months, and they maintain the results, and that's great for them. There are also some patients that go down to once a day and they start to lose the efficacy. So I think it really depends on the individual, and I really can't answer that question. Um, the patient I saw today who've been using Happy for 4 years, he said that recently he's kind of been slacking off of it, and then he started to realize that he's losing more hair. So he's gonna go back and start doing it twice a day again. But he still looked great. I'm gonna show you the guys the photos next week. I know Redney with Finasteride helps with hair growth, but does Redney also help with topical finasteride? Yes, it does. So actually, the truth of the matter is that the studies were done with Redney and minoxidil and not Redney and with finasteride. So the idea is that the Redney kind of slightly irritates your scalp, so it allows better absorption of basically, honestly, any product. Uh, so uh, so yeah, so the Redney, so even the dutasteride is gonna have Redney in it because it's gonna help the dutasteride gets absorbed better into your scalp. So do you apply Happy Head then you derma roll or you derma roll before? So that's a great question. In our original literature and probably in our literature right now, it said that you should derma roll first and apply the Happy Head on top. Um, Recently we've kind of switched things up a little bit, and so we say actually apply the Happy Head and then derma roll on top. There's really no right or wrong way of doing it, and you could try yourself and see which one works better for you. I think right now the idea is actually apply the Happy Head first and derma roll on top of it. That's going to allow for better penetration. um, One other thing, is there a cause for gynecomastia side effect when using the topical of finasteride? As I've heard that there could be an issue with oral finasteride. Yes, with oral finasteride, patients could have gynecomastia, and I've seen it. In clinical studies of topical, gynecomastia was never reported as a side effect. With respect to Happy, and we've had thousands and thousands and thousands of patients on it. I don't think we've had ever one patient complain of gynecomastia. Have anybody heard it? No. I'm not saying it's not possible. It is possible. It's just very rare, and we've never had anyone complain about it. But yeah, anything could happen. Um, can I order multiple bottles if I know the formula works? Yes, you could order multiple bottles at a time. I think you could order 3 bottles or 6 bottles at a time, and you do get a discount on it. Uh, the only one you cannot order like that is the water-based formula, because the water-based formula has a 1 month expiration date. So that's going to be harder. But if it's a non-water-based formula, usually the expiration is about 6 months. How much pressure should I use? So it's very light pressure. So it's the same pressure that you apply your deodorant on. Very light pressure. Do not make yourself bleed when you apply the Derma, please. Very gentle pressure, basically, on top of the scalp. Well, guys, thank you so much for joining us in another session, with Dr. Ben. Again, thank you so much to Eric, our VP operations, Evelyn, who makes everything basically happen here. And again, if you really like the show, I really highly would highly ask you guys to write us a review either on Facebook or Trustpilot or BBB. We really get a lot of customers by just reviewing us, so we really appreciate it. Derma rollers should be done on bald areas as well as areas with hair. So here's the thing: if you have bald areas, those areas just not gonna grow hair. I mean, that's the truth. Now, I'm a little more of a pessimistic person. I've had patients who said they were bald and they did derma roll and the hair came back, and that's great. But majority of the time, if you are bald and you're derma rolling, it's not really gonna help you.
To follow up with that question, how long do you say like if you have to have hair loss in that area for it to not come back? So like 2 years or so.
I don't think it's the hair. I mean, so Evelyn's asking how long do you have to have hair loss in that area for the hair not to come back? I don't think it's the number of years that matters. It's really what you see clinically. So the idea of any topical or oral hair product is that if you're thinning out, that means you look at the scalp and basically the light hits you and you're able to see the scalp. That's the definition of thinning, which means the hairs are there to just have miniaturized. Now, if someone's bald, and there's no hair follicles there, I mean, there's no hair for it to come back. I mean, you just need to have hair transplant. All these products on hairs that are already there, that are miniaturized, so you're strengthening those hairs and they're making them thicker. How do I clean the derma roller? Just get an alcohol spray and just spray it once further wash it and into the sink and then spray it and that's it. Yeah, but you should probably clean it every night if you're gonna use it, and you should probably change it out on a monthly basis. And again, Happy It does have derma rollers. We're giving out derma rollers, right?
Yeah.
Yeah.
Everyone who attends gets a free one.
Oh, great! Everyone who attends gets a free derma roller. That's great. You're gonna get your derma roller for free. All right, guys. Again, have a beautiful day. Thank you so much for joining us. Again, please, if you don't mind, take literally 30 seconds to write us a review on Trustpilot or Facebook. We really do appreciate it. Thanks so much. We're gonna see you guys next week. Have a beautiful day. Bye bye.